Plastic surgery was a natural for me. I mean, it's the one field of medicine that kind of combines the technical and the scientific with the artistic and the creative. We're operating on the skin and the underlying structures with the hope of creating changes in the psyche of a patient.
Actually, I started going through my albums, and I was looking at photographs of myself way back when. And I've noticed just over the last 5 years that I've started to significantly change. My physical appearance started changing. A lot of people who see me say, you know, you look great for 50. And I look in the mirror and I don't see what I used to see. I see the aging lines, I see the sagging, I see my double chin, I see the wrinkles. And inside I feel really young. I feel like I'm in my 20s or 30s, but outside I look tired. The kind of energy I have inside isn't visible on the outside. And I never know if people are saying that just to be nice or if they really mean it, but it doesn't really matter to me. I want to do this for myself.
My patient is Beverly Strong. She's a 51-year-old unmarried woman. She's a career woman and has 2 grown children. She's active, takes good care of herself, and is interested in doing everything she can to continue to have the best possible physical appearance. And what we've found from our experience is that generally it is people who already are taking care of themselves, who are already doing things to maintain their appearance, who are willing to go to the effort, trouble, and expense to have cosmetic surgery.
I'm interested in hearing about what your concerns are with regard to your appearance.
I feel young inside, but when I look in the mirror, I feel that everything's sagging. I'm dissatisfied with the way my neck is looking. And underneath, I feel like I look tired. I have some bagging under here and some loose skin on top here. And otherwise, I'm pretty happy.
And you want to look better for your own self?
For myself. Yeah. This is for me.
Yeah, I think
it's not for anybody else but
right.
me.
I think that's critical, and
right.
That's really what we want patients to understand, is that the motivation for any kind of cosmetic surgery, whether it's facial surgery or another part of the body, is really to enhance their feelings of self-esteem, to give them a greater sense of self-confidence, to feel better about themselves.
The major criteria by which we would define a good candidate is somebody who has a deformity that we can correct and somebody who has realistic expectations.
Some of the specific concerns that you've mentioned are typical of the aging changes that occur in the facial region and the tissues around the eyes and in the neck. And the typical patient who's seeking cosmetic facial surgery is concerned generally about wrinkles of the upper and lower eyelid skin, bagginess of the eyelids, deepening of the nasolabial crease, that is the cheek fold here between the nose and the upper lip, sagging of the jowl area, laxity of the tissues of the neck with an accumulation of fat sometimes in the area underneath the chin. And so your concerns are very much typical in that regard, and there are some excellent procedures that have been developed over the years to correct these problems. Mm-hmm. You mentioned the problem with excessive skin and wrinkles of the upper eyelids, and that is something that we can address with an operation known as a blepharoplasty or an eyelid tuck. In the upper eyelid, we start out by making a crescent-shaped skin incision, and then we remove the skin from the underlying muscle. And after we've done that, we carefully repair the skin incision in order to achieve the best possible scar. In the lower eyelid area, the incision runs along the margin of the lid and then extends into one of the normal little creases. We elevate the skin and the attached muscle off of the deeper structures. This exposes the fat deposits of the lower eyelid. We remove those fatty deposits, and then we redrape the skin, trim off the excess, and sew the incision shut. Now let's talk about the procedures that are designed to correct sagging of the soft tissues of the face. That operation is a facelift, or a cervical facial rhytidectomy. In the facelift operation, we begin by marking the incision. The incision starts above the ear, runs in front of it, then below the earlobe and into the scalp behind the ear. We make that incision and then elevate the skin off of the underlying facial structures. This is done on both sides and also in the neck area. This gives us access to the deeper structures in the face, including the fat deposits and the connective tissue and muscle layer.
We remove the fat that's accumulated in the neck area, and then we make some incisions in the muscles and in the connective tissue of the deep structures of the face in order to tighten these regions. After that's complete, the skin, which we've elevated off of the face, is pulled backwards and upwards, and any excess skin is trimmed off, and then the incisions are sewn shut. Computer imaging can sometimes be useful to help show the changes that we anticipate with your upcoming surgery. And Gus is going to show us how some of these areas are going to be improved, the anticipated improvement after the facelift. Some of the most dramatic changes, Beverly, are going to be in the neck area. What Gus is doing now is really showing us the effect on the profile view of removal of fat from under the neck, tightening of the platysma muscle, and the redraping or recontouring of the skin.
That's amazing. Keep going. That looks good.
We want to make sure that patients understand that while this type of a computer demonstration can give some indication of what the anticipated result is, it's not a warranty or a guarantee as to the way you're going to look when we're finished.
I understand.
Which puts the picture side by side.
Yeah, I think that's even more impressive. Yeah.
But this is what bothers me so much. Yeah, the most.
Just before the operation, I always meet with the patient in order to mark out the areas of skin we're going to remove and the fat we're going to take away. I'd like to introduce you to Dr. Arthur Jensen, who's a plastic surgeon. We work together as a team, as you know, and Art and I are going to be doing your surgery together this morning.
Good.
I think that's all we need to do for now.
Okay, thank you. That's a lot.
Yeah, it is a lot. It is a lot. Okay.
Thank you. Okay.
Let's talk about that.
It's a big day. Here we go.
Generally, we see patients 2 days after surgery to remove the bandages.
How are you? Okay.
I'm great.
Getting
Courtney,
there.
how are you?
I'm okay. Feeling very good, actually.
You know, what we're going to do today is take all your dressings off and take those little drains out. These
Okay.
sometimes take a few minutes to get off.
That's fine. Take your
Because we kind
time.
of wrap your hair in it as we apply it.
I feel really
Seem
good.
to be really good.
Ah,
That's
just feeling that come off feels like heaven. I can hear again.
yeah. Let's just try to remove this from behind your ears.
Oh, fantastic.
Your neck and chin and everything look just great.
Oh, fantastic. Oh my God, that's wonderful.
It's going to be great.
I have no double chin. Oh my God, that is amazing.
Looks really good.
God, what a difference. Oh my God. Oh boy. Oh my God. I look so old in these. I look so old. Every day I feel that it looks better and better. It's not that I'm looking in the mirror and seeing somebody else. It's just that I'm looking in the mirror and seeing a younger me. I feel that it's still healing. I still have some healing scars and things like that that are healing. I feel very lucky. I'm very fortunate, really. I know that in this world, sometimes people go out and get this done and they're not quite as pleased, and maybe they're doing it for the wrong reasons. I think you have to really investigate within yourself. Why would you want to do this? You know, as I talked about before or mentioned previously, growing old gracefully. You know, everybody's had a standard for what that means. To me, this is my way of growing old gracefully.